Hey health warriors. Homelessness isn't just about housing, it's about health. People experiencing homelessness face higher risks of chronic illness, mental health challenges, and barriers to basic health care. Public health nurses are often the bridge, bringing care and compassion directly to those who need it most. Today, let's look at how nurses serve vulnerable populations and advocate for lasting change. Health challenges in homelessness. Individuals experiencing homelessness often struggle with higher rates of chronic conditions like diabetes, hypertension, and respiratory illness, mental health challenges and substance use disorders, increased exposure to infectious diseases due to crowded shelters or unsanitary conditions, barriers to health care such as lack of insurance, transportation, or mistrust of systems. These challenges create a cycle of poor health and continued vulnerability. The nurse's role. Public health nurses step in by providing direct care like wound management, vaccinations, and screenings, offering health education on hygiene, nutrition, and disease prevention, helping individuals navigate resources like clinics, shelters, or social services. They meet patients where they are, whether that's a shelter, a street corner, or a community outreach van. Strategies for building trust. Building trust is essential. Nurses use non-judgmental presence by treating each person with dignity and respect. Consistency by returning regularly to the same locations to establish reliability. Partnership by involving individuals in their care decisions rather than imposing solutions. Trust opens the door to better health outcomes. Advocacy for equity. Beyond direct care, public health nurses advocate for systemic solutions, affordable housing initiatives, expanded access to mental health and substance use treatment, policies that address poverty and inequity at the root. By speaking up for vulnerable populations, nurses drive change that extends far beyond the bedside. Bottom line, care and advocacy, hand in hand. Public health nursing with vulnerable populations is about more than treating illness. It's about restoring dignity, building trust, and addressing inequities. Through compassion and advocacy, nurses bring health and hope to those often overlooked. If you've worked with vulnerable populations, share your insights in the comments and subscribe for more public health nursing perspectives.